Hi, my name is Caitlin. I'm a nurse practitioner student at Texas State, and today I'm going to be doing a focused health assessment on my patient. So we already went ahead and did a comprehensive health history, and we got a set of vital signs, and we had our patient change into his gown. So our vital signs, out of the ordinary, he had tachypnea with a respiratory rate of 24 respirations per minute and a temperature of 100.5. He's coming to the office today with complaints of a fever at home of 100.7, productive cough with green mucus, and some chest pain. So we're going to primarily be focusing on the waist up today, and we're going to go ahead and start off with ears, nose, and throat. So I'm going to get my light here and take a look at my patient's nose, looking in bilateral nares. Okay, noting that his middle and inferior turbinates are a little bit red. There's no swollen turbinates or boggy, and there's a small amount of green mucus. I'm going to go ahead and move on to the ears. Actually, let's move on to the throat first. Go ahead and open your mouth. Give me a big ah. Stick out your tongue. Okay, looking at the pharynx, noting that his is red. I don't see anything swollen. His tonsils are not visible, and there's no pus or other mucus production in the back of the throat. I'm going to go ahead and move on to the ears, just because he's been having some fever. We want to rule out a possible ear infection. So for adults, we always pull up and back. Taking a look at tympanic membrane. Okay. And his looks normal, which is pearly gray, translucent, got a good conical light reflex, no redness, no bulging, and also no perforation. I'm going to go ahead and look at the other side. Same thing, up and back. All right. Looking at the same thing here, as expected, pearly gray, translucent, tympanic membrane. It's not red, no bulging, no perforations. So now we're going to go ahead and look at his lymph nodes. Again, because of the symptoms that he's coming in for, we want to rule out any other issues, which would be signified in the lymph node enlargement. So I'm going to start with preauricular, postauricular, occipital, tonsillar, submandibular, submental. Then we're going to do anterior cervical, posterior cervical, deep cervical, and supraclavicular. Now, upon my palpation, I did not notice any enlargement of the lymph nodes. They weren't palpable for me. And I would ask my patient if he had noticed any tenderness upon palpation.
No.
No. Okay. So that's as expected. Next, we're going to go ahead and move on to our chest and our lungs, again, because he's coming in with complaints of a cough and also some chest pain. So we want to look at the lungs and the heart. So first we would inspect the chest, looking for any signs of respiratory distress, which would be accessory muscle use, dyspnea, retractions. And he did come in with some tachypnea, so his heart rate or respiratory rate is a little bit high, but otherwise I can't see any signs of respiratory distress. We would go ahead and also palpate the chest, feeling for any crepitus, any other abnormalities. Okay. As expected, I didn't feel any crepitus. Next, we go ahead and auscultate or percuss our lungs. So normal lung percussion is going to result in resonance. If there's an infectious process or disease process going on, we might have hyperresonance or dullness, which is what we don't want to find. Okay, and he has resonance, which is what is as expected. And next we're going to auscultate. So we're going to auscultate anteriorly, laterally, and posteriorly. So we're going to start off anterior. So I want you to give me an exaggerated, like, when you breathe. Good. One more. Go ahead and put your arms up. All right, deep breath. One more. All right. We got 2 on this side. Put your arms down, take a break for a second. So upon auscultation of his lung sounds, I heard some slight wheezing bilaterally, anteriorly, and laterally, which could indicate a infectious process or disease process. So next I'm going to go ahead and move on to his posterior chest. And the first thing I'm going to do is palpate for tactile fremitus, which is the vibrations we feel through the chest wall. So I'm going to put both of the palms of my hand on the bifurcation of his bronchi and have him say 99.
99.
Okay, go again.
99.
Okay. And I'm feeling, as expected, tactile fremitus, no increase or decrease, which could indicate lung consolidation. We're going to go ahead and listen to lung sounds on the posterior side. 6 different areas. Deep breath. Two more. Okay, thank you. And like I heard, anteriorly and laterally, he does again have some slight wheezing on each side of his lung here. So next we're going to go ahead and check out his heart, just because he did come in with some chest pain. So we want to rule out any issues with his heart. So I'm going to have him lay down on the table here, head up here. Okay. And so we're going to start off inspecting the chest, looking for any heaves or lifts. And I don't notice any, just looking at his chest here. Next we go ahead and palpate again for heaves, lifts, or thrills in the precordium. Okay, ending here at the point of maximum impulse or the apical impulse. Okay, and it's as expected. And I'm going to go ahead and move on to auscultation. I'm going to auscultate the apical rate. Now normally you would listen for 1 minute and count your apical rate. Okay, so I listened for 1 minute and I got a pulse of 90. So next I'm going to go ahead and auscultate through the different areas of his heart here, starting with aortic, pulmonic, Herb's point, tricuspid, and mitral. Okay, and then I'm going to go ahead and listen with the bell of my stethoscope as well. In aortic, pulmonic, Herb's point, tricuspid, and mitral. Okay, and upon auscultation, I heard S1 and S2 heart sounds. I did not hear any extra S3 or S4 heart sounds or murmurs. I also did not hear any friction rub as well. So his heart sounds good. So I'm going to go ahead and have my patient sit up on the side of the table here. All right, and at this point, we're finished with the focus assessment. So you'd gather all the information that you just assessed and create a few different differential diagnoses, and then go from there to create a treatment plan. And that's all I have for you today. Thank you.